I congratulate all of you sincerely because this special event truly marks the beginning of the rest of your lives. As you all walk across this stage in a little while, as Dean Scott helps you don your first white coats, and as you officially become members of the medical community, I hope you feel a sense of pride in all of your accomplishments that have helped you to get this far, and a sense of excitement for what is to come. I also want to stress the significance of the signing of the honor code. Our honor code is meant to foster a sense of trust and responsibility among students and between students and faculty. Your signature is thus a symbol of your pledge to uphold the ethical and professional ideals that are so valued and so important in the medical world. Today is a rite of passage experienced by many generations of physicians before you. We are glad you will be able to share this day with your family, friends, and new colleagues. Welcome to all of you. With that, I would like to introduce Ivy Haskins and Megan Lofton, two of the co-chairs for this year's orientation. They, in addition to Tom Fogarty, who unfortunately could not be here today, have worked extremely hard all summer to make sure your orientation has been a huge success, and they truly deserve your round of applause.
It is my great honor to introduce President Stephen Knapp, the 16th president of the George Washington University. A distinguished scholar with nearly 30 years of experience in higher education administration, he is beginning his third year as president. Before coming to George Washington, President Knapp was provost and senior vice president for academic affairs at the Johns Hopkins University. He earned a master's degree and doctorate from Cornell University and a Bachelor of Arts degree from Yale University. The president is a specialist in 18th and 19th century English literature. This is the third white coat ceremony in which President Knapp has participated. Since many of us are new to GW and the School of Medicine and Health Sciences, I want to take a few minutes to tell you about President Knapp's vision for GW. President Knapp's priorities include building partnerships with organizations and agencies throughout the nation's capital, increasing GW's prominence in research, addressing issues on affordability of higher education, and strengthening connections with GW's worldwide community of alumni. It's good to know that these priorities have a direct relationship with the School of Medicine and Health Sciences. Because of GW's strong partnerships and outreach initiatives in our own backyard, we have meaningful ways to reach out into the community and make a real difference. We are learning the practice of medicine in a thriving and challenging urban city. Because of the relationships GW has forged, we will get the chance to have experiences unique to GW. President Knapp's continuing focus on increasing the university's research capacity will expand our chances to be part of groundbreaking research that could change the face of medicine around the region and around the world. He is a president that cares about students. Since his arrival, he has convened task forces on sustainability, public service, science policy, and health policy. He is also tackling the issue of making higher education affordable. I also think it is great that President Knapp is working to build relationships with GW's international alumni community. That means that when we graduate, and we will graduate, we will be part of a worldwide community of colonial friends and colleagues. We can all get behind President Knapp's vision and priorities for GW because they are at the very heart of the goals and aspirations of our School of Medicine. I'm glad that I have the opportunity to tell you a little bit about him today. It is my pleasure to introduce President Knapp and welcome him to the school's white coat ceremony on behalf of all the students, the staff, our alumni, and our family and friends.
Thank you. Thank you for that very nice, very kind introduction. Dr. Williams, Dr. Grover, students and families of the medical school class of 2013. I can't think of a more exciting or more moving way to begin a new academic year than by welcoming our newest medical students to the ceremony, presenting them with the symbols of their vocation. This is my third opportunity to participate in this, and I found it to be one of the most meaningful ceremonies of the entire academic year. In this way, we acknowledge and celebrate our students' choice of a lifelong mission of caring for others and their dedication to a long and arduous, but we also hope a joyous road of preparation. Today's ceremony welcomes 188 first-year students into the long and proud history and the strong academic community of the George Washington University School of Medicine. Next Thursday, our new students will seal their membership in the broader Washington community when they join our second-year medical students, as well as physician's assistant and physical therapy students, and the school's faculty and staff in providing direct services across the city. As you begin your medical training, policymakers in this city are debating healthcare reform and will be making decisions that will transform the profession you have chosen. By virtue of where you have decided to go to medical school, you'll be in the thick of these discussions, so I urge you to listen, to learn, and to be involved. Members of the class of 2013, you are a truly extraordinary body of aspiring physicians and medical scientists. You were selected from many thousands of your peers, more than 13,000 in fact. But you have also selected us. You have chosen to come to the George Washington University because you know that here you will learn the art of medicine in a vital urban setting that also happens to be the seat of power and policy in the modern world. I trust you'll take advantage of the many opportunities available to you in the nation's capital, opportunities for hands-on learning, direct service, cultural enrichment, opportunities to explore the profound connections between the care of patients and the broader public health and public policy contexts that will affect every aspect of your and your patients' lives. You'll also become connected with a community of friends, colleagues, and supporters who will open doors for you for the rest of your careers. In fact, you are already experiencing one expression of that community. Today's ceremony is a creation and a gift of our medical school alumni, your predecessors, who are well known here at GW as among the most dedicated alumni we have. I look forward to the day when you will join them as you cross this stage to receive your diploma and sign the book as Medicinae Doctor, MD. Congratulations to you all.
Thank you, President Knapp, for joining us today. I would now like to introduce to you Dr. John Williams, Provost of the George Washington University and Vice President of Health Affairs. Dr. Williams has provided administrative leadership to GWU for over 20 years. In his role as Provost and Vice President for Health Affairs, Dr. Williams is responsible for administration and oversight of the Medical Center, which includes the School of Medicine, the School of Public Health and Health Services, and the GW Hospital, where he served as medical director for 2 years. Dr. Williams was actually once in your shoes. He earned his MD degree here at GW and no doubt remembers that day when he received his white coat. In addition to his MD, he also holds a bachelor's in government from Boston University, a master's of science from the London School of Economics and Political Science, a master's in public health from Yale University, and an education degree in human resource development from GW. Dr. Williams is a professor of anesthesiology and critical care medicine, health services management and leadership, and Blodern Professor of Administrative Medicine. Dr. Williams has been recognized with numerous awards and honors at GW, nationally and internationally. We appreciate his quest for excellence, his concern for students in the community, and are inspired by his enthusiasm and energy. Oh, and if you hear someone say that they talked to Skip, that's how most people around here refer to Dr. Williams. Skip and Dr. Williams are one and the same. Please join me in welcoming Dr. Williams.
Good afternoon. This is a celebration. Good afternoon. Much, much better. Let me start off by saying that Dean Jim Scott will be here a little later during the ceremony. He actually has a son-in-law who is receiving his long white coat from the health sciences part of the medical center. And he will be here to make sure that you recite your oaths and participate in the reception. Once again, let me congratulate the class of 2013 for taking the first step to realizing your dream of becoming a physician. Let me also thank all of your loved ones, friends, and relatives who are here today. You are the ones who have been and will continue to be a major support on this journey. Class of 2013, we are so pleased that you have chosen the George Washington University School of Medicine to receive your medical education. We have a tradition that dates back to 1825, a tradition of producing outstanding clinicians, teachers, and researchers. Your laboratory, as President Knapp has mentioned, is the nation's capital. We will teach you new ways of looking at healthcare through the lens of health policy. We will teach you to recognize and diagnose diseases that have long been eradicated in this country but remain a scourge in the developing world. Above all, we will teach you to take care of your patients and make a difference. While many in other professions will struggle to make a difference in others' lives, you, by the nature of your choice of this profession, will put on your white coat and begin to make a difference in your patients' lives. This journey will be difficult and challenging at times, but rest assured, the faculty, staff, and administrators of this school and the university will always be there to assist you. Now, let me just tell you the secret of success in medical school. I hope you're listening. Never stand when you can lean. Never lean when you can sit. Never sit when you can lie down. And never, ever be awake when you can be asleep. Congratulations and best of luck.
Thank you, Dr. Williams. It is now my pleasure to introduce Dr. Stephen Weisbart. Dr. Weisbart is presently a urology resident at Mount Sinai University in New York. He attended GW as an undergrad and 4 years ago sat in your seat as an incoming medical student. He graduated last May, and GW Med School is proud to call him an alumni. Dr. Weisbart was president of GW Medical School class all 4 years and is a role model to all of us. Please help me welcome Dr. Weisbart.
On behalf of the George Washington University Medical Alumni Association, congratulations on receiving your white coat. Believe it or not, it was just 4 years ago when I was sitting exactly in your seat, about to receive my white coat. And it was just last year when I was called up to this very stage to receive my MD degree. So while it does not put me very far ahead of you, the class of 2013, I have had the George Washington University School of Medicine experience, and I'm here to tell you that it is extremely special. You are about to embark on an incredible journey during your next 4 years here at GW. You will learn from leaders in the medical community, and you will then apply that information to help serve everyone from a Washington, D.C. congressman to a homeless man at a local shelter. You are also going to experience one of the greatest challenges of your life, while at the same time, you'll have the comfort of knowing that you're supported by an extremely dedicated administration, faculty, and alumni. There is no doubt that during the next 4 years, there will be some late nights of hard work ahead, new stressors, and at times, feelings of frustration. But take it from someone who only graduated last year, these times are few and far in between, and in a short 4 years, when you look back at your GW Medical School experience, you will quickly view it as an incredibly fun time. Now, when I say fun, I don't mean going to McFadden's, the local bar here on Pennsylvania Avenue 5 nights a week. That is, of course, not after March 2013, which some of you might already know is when you guys will have your match day. But the type of fun you'll have here is something way more special than that. And it's a type of fun that you can only experience as being a doctor in training here at GW. When I look back at my 4 years here, I think about how enjoyable it was for me to work with my class and administration as class president. I think about seeing my name in print for the first time as first author on a manuscript that I published with the GW Urology faculty. I think about the thrill of, for the first time, walking into an examination room, no longer as the patient, but now as the doctor in training. I think about all of the great friends that I made. I still look back and I think about the first time that I put on my white coat. Because of these wonderful times here that I had as a GW Medical School student, I will always feel a longing to stay connected to my alma mater. And I know that all of my alumni feel the same exact way. So I hope you realize that just as you can call on your administration and your faculty to help guide you through your medical school journey, you could undoubtedly call on us alumni as well. When I was a medical school student, my class certainly did. The GW Medical School Alumni Association is proud to sponsor today's White Coat ceremony as part of the White Coat Initiative. And just as 4 years ago, when the alumni provided me with my white coat, the tradition today continues as the alumni demonstrate their commitment to the class of 2013. The Alumni Association works hard every day to help ensure your great experience, although our efforts will not always be so apparent to you. After all, when I was a student, my brain was generally too filled with biochemistry formulas and causes of kidney failure to think about the role of the medical school alumni. Looking back, however, the alumni were always there for us. Maybe it was what a classmate told me, that the only way she could attend GW Medical School was through the support of an alumni scholarship. Or perhaps it was when I had frequent conversations with an alumni from the class above me who, despite being a surgical intern, took the time to coach me through my urology residency applications. As a surgical intern myself right now, I can't wait to help and get involved with GW students in any way that I can. So as you put on your white coat today, I hope you realize one thing. It's not just any white coat, but it's a white coat from the George Washington University School of Medicine. And that means it comes with the full support and backing from your alumni. Congratulations on beginning the greatest 4 years of your life, and best wishes for success here at GW.
Thank you, Dr. Weisbart. Each year, we ask interested second-year students to submit a speech to be presented at the White Coat and Honor Code ceremony. This year, it was hard to choose only one speaker, but I'm happy to say that Denise Baskey has been chosen to share her thoughts with us. Please help me welcome her.
Good afternoon, and welcome to the members of the class of 2013, family and friends. First, I'd like to congratulate the incoming class. Today, we celebrate your first step into the world of patient care and your last day of freedom before it's time to hit the library. I'm only kidding. Classes don't start till Monday. You have all of tomorrow. But seriously, today we honor the academic achievements that have brought you to this point, and we mark the beginning of your journey in your medical education. I remember sitting in your seat 1 year ago today, anxiously waiting for Dean Scott to help me put on my white coat for the first time. I had waited all summer for that coat. To me, the coat meant that I had finally made it, that my hours in front of the Orgo textbook had finally paid off, and that my fears about my future were over. But I have long since come to recognize that the white coat is much more than a coveted accessory acceptable even after Labor Day. It is a powerful symbol that represents the trust and respect our society places in us as physicians. I had thought many times before about the power doctors wield, but it was not until I donned my white coat that I really began to get a sense of the weight of this profession. When you walk into your CAP doctor's office for the first time, you will immediately be recognized as a person who can give expert advice in the matters of healthcare. The patient has no idea of your qualifications, or that you have 1 month's worth of gross anatomy under your belt. What they see is a health professional in white. And with their trust, you will have the unique ability to cross social boundaries and invade the private lives of these patients. You will bear witness to their struggles, to their triumphs, and you will undoubtedly feel uncomfortable from time to time. First year is often a humbling experience, but I encourage you never to become discouraged and to take advantage of all the opportunities you are given. In one short year of wearing my white coat, I have already been invited into the lives of many patients. This summer, I had the opportunity to work in a hospital in Istanbul, Turkey, and during my second week on rounds with the neurology residents, I came across a patient receiving cortisone infusion treatment for multiple sclerosis, a disease on which I based my research in undergrad, and a disease to which my family lost my aunt many years before I was born. The patient was crippled. She was visually impaired, and she was 24 years old. One day, I noticed that the patient was knitting despite a terrible tremor in her hands. So I approached her and I asked her what she was making. At first, I thought maybe she hadn't understood my Turkish because she sort of just looked at me. But then, after a moment, she told me she was knitting a blanket for her daughter. After several days with this patient, I earned her trust, and she told me the story of an unplanned pregnancy at the age of 20, shortly after which she began experiencing the first signs of her symptoms. I sat with her every day, I watched her blanket grow, I listened to her stories, and towards the end of her stay, she shared with me fears of difficult times to come, and she cried every time she thought of a possibility of her daughter's future without her. She allowed herself to become vulnerable in my presence, in part because I took the time, and in part because she saw me in my white coat, and she recognized that I was someone there to care for her. The white coat symbolizes the relationship between physicians and their patients. Wearing the coat comes with the great responsibility of maintaining integrity, heartfelt compassion, and professionalism in all that you do. Since meeting that young multiple sclerosis patient, I began to realize that this is a profession of the human experience. If not worn correctly, the coat can jeopardize our mission as doctors. It can communicate entitlement or superiority, or worst of all, put our patient's health at risk. In his book, Better, A Surgeon's Note on Performance, which you all read this summer, Atul Gawande writes, "Better is possible. It does not take genius. It takes diligence. It takes moral clarity. It takes ingenuity, and above all, it takes a willingness to try." As medical students, we are always striving to be better, whether it's in the exam room or interviewing a new patient. As you leave here today wearing your brand new white coat, you will probably feel better than when you arrived. Your parents and friends will look at you and they will see a doctor. You will go home and probably admire yourself in the mirror and think, "Man, I look sharp." Because you do, and you worked so hard to get here. But just remember that the next time you put on this coat, it will not be for your own benefit, but for your patient. And it will signify to them your commitment to this profession and to their health. It will mark you as someone who is striving to achieve better. Good luck.
Thank you, Denise, for your inspiring words. It is now my honor to introduce Dr. Atul Grover, Chief Advocacy Officer of the Association of American Medical Colleges. In his capacity, Dr. Grover serves as the main architect and strategist of the AAMC's advocacy agenda, effectively mobilizing the association's government relations and communications teams and resources to accomplish the legislative goals of the academic medicine community. Dr. Grover joined the AAMC as Associate Director for the Center for Workforce Studies in 2005, where he managed research activity and directed externally funded workforce studies. He became a Director of Government Relations and Healthcare Affairs in 2007. Prior to joining the AAMC, Dr. Grover was a Senior Consultant in Healthcare Finance and Applied Economics for the Lewin Group, Incorporated, from 2003 to 2005. He came to the consulting firm after serving with the U.S. Public Health Service, Health Resources and Service Administration. From 2001 until 2003, Dr. Grover worked as a chief medical officer for HRSA's National Center for Health Workforce Analysis and as a medical officer for the Children's Hospital Graduate Medical Education Program. Trained as a general internist, Dr. Grover practices medicine and holds faculty appointments at the George Washington University School of Medicine and the Johns Hopkins University Bloomberg School of Public Health, where he obtained his PhD in health and public policy. Dr. Grover also sat in your seat in 1991 when he was a first-year medical student at GW. He received his MD degree from GW School of Medicine in 1995 and completed his residency in internal medicine and primary care at the University of California at San Francisco. Please help me in welcoming Dr. Grover as this year's keynote speaker.
Thanks to make it. Well, it's a pleasure to be here today. My sincere thanks for the remarks from Dr. Williams and Dr. Knapp, and also just the presence of Dr. Scott, Dean Scott. Welcome. I'm glad you could make it. We understand that you had another ceremony to get to as well. And welcome to all of you, the class of 2013, and especially to your friends and your family who've probably done more to get you here than you ever could have imagined. And let me tell you, they're going to be more important to you over the next 4 years in the profession of medicine and well beyond that. So continue to be good to them and be thankful. This is a sort of a homecoming for me, as you can probably tell, having been a first-year student at GW 18 years ago, prior to the inception of this ceremony. And while the markers of that journey were a little bit different, a lot of the details really remain the same, and the feelings that you have will no doubt resemble what I and my friends and colleagues felt nearly 2 decades ago. So I wonder, if I asked all of you sitting here in one word how you felt today, what would it be? Probably a bunch of different things: excitement, boredom, anxiety. I'll try to keep the speech short. And my guess is that the people in the cheap seats up there would say that they feel incredibly proud. And I want to dispel a few of the doubts that some of you will have, and you undoubtedly will have them. We had them 20 years ago. You are all highly talented people. Most of you are pretty competitive. You all deserve to be here. Your faculty, the deans, others up here will always make sure that you are successful. Most of you will never ever need that extra help, but they will always be there for you, as they were there for me. So Dean Goldberg held my hand and sort of shepherded us around as first and second and third year students and beyond. Skip was Talk to Skip, even then, 20 years ago. Jim Scott wrote my dean's letter, and I challenge you to get a better dean's letter than the one that Jim wrote me. I did not know the the past president of GW as well, so welcome, Dr. Knapp. And Scott Schroth was my mentor, somebody that I was very, very privileged to know for now almost 20 years. All of you will have the letters MD after your name in just a few short years. And none of these people here and none of those people there want to see you fail. And you're all here for a reason. Some of you will have been driven by a love for science and will be able to ignore that horrible smell of the gross lab, because you'll revel in the wonders of the human body, courtesy of somebody else who also believed in you, and believed in you enough to leave you the very last piece of earthly matter that they had to give. And few people in the world will see the things that you will see in just the next few short months. Others of you will, like me, find the science really a necessary barrier to the humbling privilege of sharing time with patients and their families, who will open up to you in ways that will often evoke profound emotion, as it should, and I think Denise just gave you an example of that. They will see that white coat as a symbol of trust, of your oath to keep what you hear secret. So I advise you to listen to them and remember that this too is a privilege and responsibility of the profession that you formally enter today. You will experience all of these things with the white coat you're given today, whether worn or whether it's just implied by the way that you are introduced, by the stethoscope that you carry, or the touch of your voice and your hand. And that uniform, that white coat, can do a number of things. It can do anything you want it to do. It can serve to isolate you. It can serve to be your identity as a person, if you want it to. Or it can serve as a reminder of your responsibility to your patients, to yourself, and to those that love you and have helped you earn this first symbol of entry into the profession of medicine. On some days, as you journey through your education and training in particular, you will reach for that white coat with every bit of excitement and passion that I hope you have today. And on other days, or more likely in response to a 3 a.m. phone call or a pager going off, that coat is going to feel less like a second skin and more like a giant weight, or maybe a straitjacket. And it's okay to feel that way at times. And I would urge you to learn early on how to forgive yourself as you forgive others for being human. Your ability to show compassion for your patients and yourself is just as important as your mastery of scientific knowledge, no matter what your specialty is. And so you will hear things like a chance to cut is a chance to cure from our surgical colleagues. But I would argue it's also a chance for compassion at a time when people are more vulnerable than you probably could have ever imagined. I think to do that and do it well, you need to remember what brought you here today, and it's not always going to be easy to remember that. So I would suggest that you write it down and you put it in that pocket of your white coat. Pull it out as a reminder when your coat feels more like a weight than a privilege. Because though we, your colleagues, don't intend to, we often manage to beat some of that passion and idealism out of many of you as you go through the next 4 years. Part of it may be that as soon as you reach this goal, this tremendous goal of getting into medical school, when you thought you were done, we don't really give you a chance to enjoy your success before we saddle you with the next exam and the national boards, with match day, with graduation, with internship, residency, fellowship, getting your first academic appointment, and so on and so forth. But I would urge you to remember those aren't truly end goals as much as they are important milestones in the journey that you're embarking on today with the people around you. And our profession is highly diverse, and there is room to pursue almost any vision of success and happiness. You will always earn a very substantial income, even in comparison to what will be a substantial debt coming out of this medical school. And that will be true as long as physicians continue to be respected as professionals, which depends largely upon the professionalism of you and the people around you. So again, I'd urge you to constantly remind yourself of that passion that brought you here today. To take out that card or that piece of paper and look at it when you feel the most doubt, the most despair during your journey. Try and find the things in medicine that really bring you the most joy and figure out a way to do them. Think less about your title and your pedigree. I know it's hard, but try to use the next 4 years to try and figure out what aspects of the profession of medicine really bring you the most joy. And I guarantee you that your success will be easier and more rewarding. But there will still be bad days. When I think about being in your shoes and the note in my pocket I wish I had written myself, it was pretty complex. I came to GW with a degree in creative writing, with a background in the arts, and many years of free time spent up the street at the National Cancer Institute doing bench research. And I also enjoy the ability to spend time with people one-on-one. And I remember myself as the person in college whose dorm door always seemed to read "The doctor is in," who people came to for advice or a free beer or something, and that was okay. And medicine for me was a way to combine all of those things. I just wasn't sure how to do it. But as it happened, I was here during the last discussion of healthcare reform and quickly sought out mentors, of which there are many, who would translate that discussion for me. My wife reminded me that I have to remember exactly how old you were during the last discussion of healthcare reform. We were here for the first inauguration of President Clinton, and we were just going into our second and third years as the discussion of healthcare reform came to full fruition. And it was an ugly discussion at times, as it is now. But it was an amazing time to be here. And I went to residency still interested in federal policy, only to find that San Francisco and California is a long way off from the nation's capital, in a lot of ways. But it was a highly enriching experience that gave me the best clinical training I could have asked for, coupled with my fantastic medical education, and it raised some serious doubts in me about how I wanted to spend the next couple of years and the next few decades of my life. And that time in medical school was full of hope for that new healthcare system. It was gone by the time I went off to residency. But there was a lot of uncertainty in that discussion, a lot of questions brought on by the talk of reform. And in many ways, we felt the same way that I expect many of you will be feeling now, having worked hard to go down a path we thought was certain, only to be told that everything was going to change. But if you haven't noticed it yet, change comes very, very slowly. You are all bright and very capable physicians to be, and you will weather that change without a problem. You will be successful, as long as you make sure you choose what brings you joy. It's a lot harder to be miserable if you're doing something you love every day. And there will be uncertainty, as I'm sure you feel uncertain now, and that's okay. It's acceptable at every stage of the journey. What's not acceptable is an unwillingness to change and to adapt, and you will be asked to change quite a bit. I would urge you to also help your faculty and your residents and others around you with the great uncertainty that they're facing as the nation now discusses healthcare reform once again. Help them remember why they came to medicine in the first place. Ask them what made them passionate about being here in your shoes when they first put on that white coat or when they stepped into a gross lab. And my guess is it had very little to do with death panels, with public options, Medicare reimbursement, or malpractice liability. And you should remind them of why they too entered the profession of medicine. And while you're here, just steps from the Capitol and the White House, learn something about the debate going on around you. I'll get you started. Medicare, old people. Medicaid, poor people. S-chip, poor children. That'll get you started. Because believe it or not, the white coat already makes you an expert in the eyes of others. People that you know, people who are strangers, are going to look to you for advice about their own health in bars, in the library. It's just going to be strange. But they're also going to look to you for advice about the healthcare system. So take a little time to learn about it. And I'll tell you, I'm not wearing a white coat today. I hardly ever wear mine. The coat's only a symbol, but it's a symbol of the trust that your faculty and your patients have in you. And it's going to be filled with memories and unidentifiable stains, no matter how hard you try to get rid of a few of both. For me, those memories and milestones, some of them were pretty bittersweet, and many are tied to my own mistakes and my own failures, or sometimes they were just related to the deaths of patients that I cared for, or the bereaved but grateful family members I wished I had grieved with, or just kneeling to speak with patients who were too small or too frail to rise to look me in the face. In this town, you will help care for the powerful and the most powerless of our society, and you owe all patients the same compassion and professionalism. You will, I hope, also time to enjoy life in DC, whether that's McFadden's or Mr. Smith's or the Smithsonian, and I hope you'll enjoy the company of each other. Some of you will end up married to each other. Others, like me, will make some of the best friends of your life, and don't think I didn't spot you guys walking in late. Two of my friends from medical school, dear friends who showed up today. So it's a wonderful journey that we're privileged to take, that you are privileged to take, and we are all very privileged to be part of it. I welcome you to our profession. I thank you for the honor of being able to speak to you today, and I urge you not to forget to put that note to yourself in the white coat. Thank you.
Congratulations, class of 2013. Welcome to the GW family. I am pleased to have the privilege to introduce Dr. James Scott. Dr. Scott has served as the Dean of the GW School of Medicine and Health Sciences since his appointment in August of 2004. Dr. Scott received his bachelor's degree from the University of Notre Dame in 1977 and then served in the Peace Corps for 2 years. He received his medical degree from the University of Arizona College of Medicine in 1983. Dr. Scott completed his internal medicine internship at the University of Arizona and did his emergency medicine residency at the George Washington University. Previously, Dr. Scott served as the residency director for emergency medicine, assistant dean for graduate medical education, and assistant dean for student affairs in the School of Medicine and Health Sciences. Dr. Scott became a full professor in the Department of Emergency Medicine in 1998. Among his many accolades, Dr. Scott was named the Outstanding Clinical Teacher by the School of Medicine's class of 2003, and he has received the Golden Apple Award for Outstanding Teaching 10 times since coming to GW in 1986. In addition to Dr. Scott being a highly regarded teacher, he is a valuable mentor and leader in the GW community. Please help me in welcoming Dr. James Scott.
Well, thank you. Thank you, Ivy. And to all of you, a belated welcome. I apologize for being a little late, but our PA class did graduate this afternoon, and I'm delighted to be here. This is an auspicious event. There's no doubt about that, and one that you will remember and we will remember for a very long time. I would like to thank all of our guests, but especially Dr. Atul Grover, who came here back to GW to speak to us today. We've known Atul for a very long time, and he just is one of the many, many accomplished alumni of this medical center and this medical school. And so, Atul, thank you for coming back. I also want to express my thanks to Amit Joseph and to Jason Applebaum, who put together this wonderful event this afternoon, and to all the organizers of our week-long orientation. Thank you to each and every one of you. You did a great job. So you've heard a little bit about the white coat. You've heard a little bit maybe about what it represents. And I'd like to talk about the change that it represents, the transition that putting this coat on represents. You're going to go home this evening and you're going to take the coat off. Please take the coat off. Don't sleep in the coat. And you're going to hang it on a hook, and then sometime later, either tonight or tomorrow, you're going to try it on again and check it out in the mirror. See how you can accessorize. It's white. It goes with everything. That's what's great about it. And I would guess that after doing that, you're going to feel, in general, not much different than you felt before you put the white coat on. And that's okay. That's actually how you should feel at this point. But in a way, you are different. We talked about this some yesterday, but certainly what's expected of you, how you are evaluated, how you are scrutinized, well, that's definitely different. Not because of the white coat, but because of what you've joined and what you aspire to become. The contributions that you're going to be expected to make are certainly different. Let me give you a specific example, one you may not have thought of yet. So, sometime in the last couple of months, your father, and you can put in the details of this, but at some point rolled his eyes and couldn't believe that you couldn't arrange your car insurance or figure out the rental on your new apartment or something where fathers are needed. And some point during the last year or so, your mom made some remark that made you think maybe she's not a big fan of my new boyfriend or my new girlfriend. And your fraternity brother or sorority sister at some point has said in the last few weeks, "You're really going to be a doctor?" Well, here's what I want to tell you, is that in the next few weeks, each and every one of you is going to get a phone call from that same father who wasn't sure that you knew how to put your life together, and from the same mother who, while very proud of you, is not sure you know exactly where you're going, or from that same friend who is still incredulous that you got into medical school and are going to be a doctor. And you know what they're going to say? "I got this rash." I woke up with this pain. And they're going to say, so what do you think it might be? Well, let me give you a couple of hints. Number one, you can't do rashes on the phone. There's some things you just can't do on the phone. But my guess is you're going to have this sense of, now, why are they calling me? Well, it's not because of the white coat, but it is what the white coat symbolizes. You now have crossed over into something. You are now being entered into a new body of knowledge that everyone expects you're going to be able to help them with, even when you clearly can't, at least in the beginning. I have one piece of advice for all of you. You don't know more medicine than your mom till you're at least a third year, okay? So keep that in mind, okay? So when you go home this evening and you try on the white coat, I'd like you to practice something, and that is saying, I don't know. Because you have to get good at that. Now, what you don't know, and those of us who've been doing this for a while, Dr. Williams and Dr. Schroth, Dr. Grover and I all know, is that there's a difference. The way you say I don't know is I don't know, which sends I don't know, I haven't learned it yet, I can't figure it out. We up here have this ability to say, I don't know, which suggests that it's actually unknowable. Don't worry, you'll figure that out. You'll have that out. It takes a while, but you'll figure that one out. I'm going to get plenty of opportunities over the next 4 years, plenty of opportunities to talk to the group here in the front in the white coats. So I'd like to take my remaining minutes and talk to those of you who are in the rest of the auditorium. I would like to correct Dr. Grover, however, and generally I don't correct our keynote speaker, but at GW there actually are no cheap seats, so you should know that. But I do want to say to you that that I want to take an opportunity to speak to each and every one of you who's throughout the auditorium, because it's important that you realize that the child that you raised, the woman that you fell in love with, the friend that you thought you knew better than anyone, is going to change over the next few weeks and the next few months. I was reminded by a Toole speech that one thing that's changed, at least in the next few weeks, is they're going to smell different. This gross anatomy lab stays on them for a while. But there's some other things. They're going to start to speak a new language. They're going to start to know things about patients that they can't share. And they're going to start to use words that you're not going to understand. I will say, in my family, when my brother-in-law fell off his bike and got a big bruise, the word hematoma still gets people in my family laughing around the dinner table. Hematoma is just the medical jargon for a bruise. But that's what's going to happen. You're all going to start to use those words. You're also going to develop some odd habits. And I would ask those of you here to sort of indulge those. For me, I remember it very specifically. I was a first-year medical student, and I was learning for physical diagnosis, and my wife and I had gone to the movies. And about halfway through the movie, she looks over and says, "What are you doing?" And I looked down, and I thought we were holding hands. That's what you do at the movie, you hold hands. It turns out I was actually taking her radial pulse. I'd figured out how to do that, and sort of unconsciously had my fingers on her wrist and was feeling her pulse. Yeah, there are some odd habits that all of you are going to have to get used to with the rest of the group. But I also want you to know this. For many of these students, for the first time, they're going to fail. They're going to fail an exam. They're not going to meet their expectations on a particular evaluation. They're going to not be the smartest person in the room. and they're certainly going to lose patience. And they're going to need you. They're going to need your help as they go through that. So what I would like to try to do today is to say, on behalf of the faculty and the administrators here at the George Washington University School of Medicine and Health Sciences, I'd like to enlist your support. Because I believe if we work together, this will be a remarkable class of 2013. Here's what I'm asking. Keep talking to them and make them talk to you. Go for a walk and take them with you when you go for a walk. Make sure that they read something that doesn't end in a Y, because they're going to read biochemistry, anatomy, physiology. Make sure that your loved one occasionally reads something else. Make sure that, like all Americans, they get their necessarily weekly dose of reality television. It's important that they do that. It's important that you all, who have done such a great job of bringing them to GW, raising them, loving them, creating them into the people that they are, that you don't let them take themselves too seriously while they are taking their work and their profession very seriously. You know them, you know these students better than we do, and you always will. And I know that you are very proud of them, but it's important that you keep them as the people that they are and allow them to continue to grow as physicians throughout the time that they're here. You do that, and I guarantee you of something. 4 years ago, 4 years from now, in this auditorium, we'll get together and we will celebrate great doctors. We will have the beginnings of a generation of physician citizens to change healthcare in this country. And together, we will have created even better human beings than they are today. To the students, you've earned the right to wear this white coat. You've earned the right to study harder than you've ever studied and to serve in a way that very few people are called to serve. I'm sure that if you do your part and we do our part, and with the help of all of the family and friends who are here today, 4 years from now, we're going to celebrate a remarkable event. Congratulations to all the students. Congratulations to all the families. So now it's my privilege to lead the class in the School of Medicine and Health Sciences oath. This is an oath that was written, I'd say, a little more than 10 years ago by the students and the faculty at GW. And what I will ask is for all the students to please rise. Any faculty who are here in the audience or on the stage, as well as alumni of the school. And we will read the oath together in the parts that are split up. So for all of us, we pledge to serve our patients, their families, our community, and each other with respect, competence, compassion, and humanity. We hold as our ideal the care and treatment of all our patients. From them we will learn. We hold as our ideal the advance of knowledge. Through it, disease will be understood, prevented, and cured. We hold as our ideal open-minded collaboration. To this, we are collectively committed. We hold as our ideal critical self-evaluation. Through this, we will grow. We promise to serve as worthy role models, as our own teachers have before us. We promise to support your personal and professional growth in the clinic, in the laboratory, in the community, and in your own teaching. We promise to pursue responsibility our calling to teaching, to service, and to research. We promise to maintain an environment where scientific integrity and ethical standards sustain your trust in us. We honor the George Washington University School of Medicine and Health Sciences' history of service to the people of the nation and its capital. We embrace its rich tradition of teaching and research excellence. We accept the challenges and opportunities of those alumni whom we follow, and we solemnly pledge our faith to this oath and our assistance to others to do the same. Congratulations to the class of 2004.